So Administrator Slavitt, I just wanted to ask you, have you also reviewed this GAO report?
Yes, I have.
That the chairman was asking you about? And one of the things that they said is that it was their finding that CMS had not, that had established a framework for oversight, but it wasn't always effectively executed. Did you see that finding?
Yes, I did.
And what's CMS's response to that finding?
Yeah, I believe we concurred with that finding.
I also, in the GAO report, one of the things that is of concern to me is they say none, zero, nobody, not a one of these exchanges are meeting the desired operational outcomes in all functional categories envisioned by CMS. So at this stage of the process, doesn't this demonstrate that the systems are incomplete and incapable of functioning properly?
Yeah. What I could tell you today is that all of the exchanges are functioning, serving the members in their states and their communities, and all of them have run into their share of challenges. None of this was easy. Some of them bigger challenges than others, but there have been some that are very successful, and I think the experimentation model of states doing this on their own has had
Okay, then
merit.
how do you answer the GAO's assessment that none are meeting the desired functional outcomes?
I think at any given point in time, there have been challenges, been things that have been delayed, have been contingency plans, and so these.
But nobody
is
is meeting the desired outcomes. We continue to get complaints about these exchanges. We hear from people that, the dissatisfaction is rampant. It costs too much. It's too expensive to use. The exchanges don't work. And then you get a GAO report that says nobody is hitting the metrics. So why did you continue to put money in on this? If they're not meeting the functional outcomes, the desired outcomes, why are you continuing to put money into this?
So I understand the question, and it's an important question. Of course, 2.9 million people have been covered. I think that's their primary job of these exchanges. I think they are reaching the needs of populations that have never been covered before, and I think they're
So we've
rising to those
spent
challenges.
4.5 or could spend $4.5 billion to get access to 2.9 million people. That's what you're saying.
I'm saying the states have reduced their uninsured rate, the states that have state-based marketplaces, to under 10%, and they're still in the establishment phase. It's still early on. They're still working and building. And if we believe that there's money that's been either improperly spent or is money that's been part of a grant that's no longer needed, we have every ability to collect that money and we'll bring it back. And so I think
So if you were in the private sector and you were 5 years into a rollout and you still weren't functional, would you give yourself an A or an F?
Yeah, I wouldn't agree with the characterization that they're not functional at this point.
Well, the GAO says they are not. So then you're disagreeing with the GAO report.
I would say that at this point in time, the states are all functional. Are they perfect?
Okay, so you disagree. Then the GAO says not any of them have hit the desired operational outcomes in all functional categories. Mr. Slavitt, that means it ain't working.
Well, let me take a look at the language they use, and let me get back to you on the.
Well, I would think
characterization
that
of
you
their
would have
report.
known that answer if you're functional or not before you came to us, Shieldback.